That's fine.
Okay, so my name is Peta-Gaye Ford. I'm currently the risk reduction specialist at Harris County Public Health.
Great, great. Thank you for taking the time today to speak with me about HIV prevention at Harris County. So the first question I have for you is, how long have you been working in the field of
Okay,
HIV?
so in HIV, back
Mhm.
home in Jamaica, I was in the field for 2.5 years. I was a part of the prevention team as well as the treatment and care team. So for here at Harris County, I would say roughly around 4.5 months I've been in the
Okay,
field. Mhm.
okay. And what attracted you to your current role?
Okay, so back home, I really had a passion in serving persons, helping and assisting, and I have grown to love the field of HIV and STI.
Yeah.
So when I came here, I told my mom the only way I'm gonna work in America is unless I'm gonna be in exactly the same or something that's similar to what I was doing back home because I truly had a drive and a dedication in regards to educating persons about HIV, STIs, as well as allowing them to be more aware. So when I saw the post, I was like, yes, this is mine, and I applied. So
Yeah,
that was what my drive and the passion that I had back home. That's what actually drew me to the post that I'm in right now.
that's amazing. Awesome. Thank you. I'm so glad you're at Harris County. One of the questions I wanted to ask you was, how does childhood trauma affect health outcomes in communities of color?
Okay, so for kids, even like myself,
Mhm.
I believe that trauma is something that affects us emotionally, physically, as well as psychologically.
Mhm.
So, as a child, when you see like your mom being abused, or you yourself being abused, or some incident or something that happened while you were younger, there may be something that will trigger it when you get older. And as a result of that, you may as the years go by, you may be suffering from depression, stress, anxiety, as well as where relationships are concerned. You will have this need of not being fully committed or fully into that relationship because of how you had suppressed those feelings or those emotions.
Yeah.
So it affects community of color a lot because for some persons, how they suppress whatever trauma they're going to, they tend to put themselves more at risk by turning to drugs, being involved in toxic relationships where they would be abused again,
Hmm.
as well as being criminalized by society where they are seen as persons committing juvenile acts.
Right.
So it has truly affected the community of color a lot, but I believe that we can overcome this by focusing more on going into community centers,
Mhm.
going in school when it's possible, or doing virtual interactive sessions by empowering the community of color as well
Yeah.
as trying to give them a voice to let them know, hey, you're not in this alone and we're here. And with the step-by-step approach,
Yeah.
which psychologists use, which they call the ACEs, we can help
Yes.
to overcome the barriers of trauma as well as what affects the persons in communities of color.
Yes, I completely agree with that. Speaking about the community, there's a lot of stigma in our communities, Black, Hispanic, what have you. Um, what, and I know like in gay relationships, like, HIV testing, that idea is more prevalent, but in heterosexual relationships, um, there seems to be a stigma, especially surrounding HIV testing, because people think that the HIV does not affect them. What would you say to someone who doesn't think HIV can affect them?
Okay, so you would have to let them know that you will not know unless you get tested. And it's not going to be like, oh, because I'm Black, HIV won't affect me because I'm Black, or because I'm Hispanic, it won't affect me. It
Yeah.
affects everyone because you can't see, you can't know unless you get tested or look at a person and say, oh, this person has HIV.
Right.
Like, for example, with COVID, you see the symptoms of COVID. So you know, hey, this person has COVID. So
Yeah.
if I don't do what I'm supposed to do, I won't get COVID. That's not how HIV works. It
Yeah.
doesn't show itself and say, hey, I'm HIV positive. Be
Right.
careful. So you have to just allow them to say, explain to them the whole process and let them know these are the preventive measures or these are what you need to do to get yours to be safe. And if it's that you don't believe you won't get it, these are the options that we have. So we just hope you can take these into consideration in regards to protecting yourself and be
Yes,
safe.
definitely, definitely. Lastly, how do you think Harris County's prevention program is different from other programs? Like, what
Okay,
sets us apart?
so with the Harris County program that we have here in the HIV department, it's testing 1, 2, 3.
Hmm.
Testing 1, 2, 3 would be uh, set apart from the other programs because it is a mobile unit as well as it's more convenient for our clients.
Hmm.
So we actually bring the service to you instead of you going into a clinic.
Yeah.
So it's more confidential as well as I stated convenient. So it's to your suiting.
Hmm.
So based on our service as well, you actually text us. So it's not something where everybody knows your business. It's more conservative and it's
Yes.
focused more on the client and their needs. So
Yes.
that's why I would say we actually are set apart from the other programs.
And I know this question isn't on our list, but what would you tell somebody who just recently was diagnosed with HIV?
Okay, so when a person is recently diagnosed with HIV, they're gonna be first, you have to decide how is it that you would have to deal with the situation because they can be in denial,
Hmm.
they can be angry. You can just let them know that, hey, these are the options we have available for you. We let them know the support team, let them know that you have a dedicated team that's there to help them because number one, they're going to need a support system.
Right.
And without a support system, it's not going to be easy for them to cope with the diagnosis.
Wow.
So once you let them know that the support system that you have there that's established with the clinic, as well as finding out from them what support system they have back
Mhm.
home, and if it's based on their sensitivity of how they would want to confide in letting somebody they have know of their situation, that's what you'd have to discuss with them as well. But let them know that HIV is not a death sentence. That's number
Mhm.
one. Let them know they can live with HIV. Let them know it's the same as a person who is diabetic, hypertensive, and how you can monitor by ensuring you take your medications as well as be safe and practice safe sex. So letting them know that it's not the end of the road for them because they can still live on, that's words of encouragement that I would definitely tell somebody that's HIV positive.
Yeah, that's great. That's real. Those are really positive words. Well, those are all the questions I have. Is there anything else you want to add to your video?
Well, just thank you so much for giving me the opportunity to talk in this. And I really hope that this message will make a difference. So, again, thank you so much.
Of course. Thank you, Peta.